Well, good morning, everybody. This is a pretty amazing group here. So just really quick, because this is a rally, look what you guys did. This is amazing. I mean, this is amazing. I literally, when we were driving up, I had just sort of a moment where I wanted to cry. These are lives. We are united in blue here in Washington, D.C., representing the 27,400 flags here that represent lives. By 2030, colorectal cancer will be the #1 cancer killer if we don't do something today. And I just want to recognize every survivor, every caregiver, every healthcare provider, every policymaker that's here in the room, here in Washington, D.C., that you're here in the fight against colorectal cancer. Every single person here has a role to play. And Fight Colorectal Cancer is so grateful to be a partner with all of you, because it is truly, today we all bleed blue. This is our fight together, and we are fighting for more. So I just want to recognize everyone who's here and everyone who volunteered. We had over 200 volunteers who put a stake in the ground, a flag in the ground in memory of someone they loved, in memory of their own fight, a memory of a friend. And I just want to thank everyone for being here, because it means so much to us as an organization. And we are committed to changing policy to increase access to care, access to screening, and funding medical research to find a cure. And that is our mission as an organization. It is a shared mission with many organizations here that represent survivors, caregivers, and healthcare providers. So thank you for being here. Really quick, again, we couldn't do this without the support of many individuals and many organizations and companies. So I am so grateful for our sponsors. And I'm going to have to go through the list. I think you all know the procedure here. Fuji Film is a sponsor. Merck, Miralax. If you haven't tried our Miralax toilet, Throne did an amazing job over there. So please, it is luxury. Amgen, Exact Sciences, Daiichi Sankyo, Genentech, Taiho Oncology, BMS, Guardant, Intuitive, Natera, Foundation Medicine, Excellius, No Shave November, Pfizer, Rouge Center for the Cure of GI Cancers. I'm so excited to have your support as an organization, and truly, their investment is in our survivors and our community, and we are so grateful for that investment. To kick us off, we are so grateful to have Brendan Griffith to join us. He's a stage 3 colorectal cancer survivor from New Jersey who will be introducing our next speaker. And I got it right, Brendan, not Brian. Thank you so much.
Thank you so much. Hey. Good morning, everybody. As Angie said, my name is Brendan Griffith, and I'm a stage 3 colorectal cancer survivor from West Orange, New Jersey. And this morning, I am honored to introduce Congressman Donald Payne Jr. Representative Payne proudly reps New Jersey's 10th Congressional District. He has been a steadfast champion for the colorectal cancer community since losing his father 11 years ago this month. Representative Payne was instrumental in the Removing Barriers to Colorectal Cancer Act, having it passed. He's co-chair of the Colorectal Cancer Caucus, and he has been relentless in his support for policies that save lives. Representative Payne, please.
Thank you. Good morning. Good morning. Well, when I heard it was 5 degrees out here, I thought that, maybe we should go inside, but it's not that bad. But we're here for an impactful reason, and to see these flags, I'm still just trying to get over it as I walked up here. This is incredible. It's an honor to participate in your United Blue event. I want to thank Fight CRC for the invitation to speak with you today. This event is a tribute to the survivors, the caregivers, and the champions in our fight against colorectal cancer. And it is important to commemorate them today. Colorectal cancer is the second highest cause of cancer deaths in this nation. This is about 153,000 Americans will be diagnosed with this dreaded disease this year. And more than 52,000 people will die from it. Yet, colorectal cancer is one of the most preventable types of cancer detected early, which has always made no sense to me. This is why events like this one are so important to us in the fight. They raise awareness and encourage more Americans to get screened to catch it early. This is very personal to me. As it was stated, I lost my father, the late Congressman Donald Payne Sr., on March 6th of 2012, and I followed him into Congress. I tell people that I probably came to Congress in the worst way you could, losing a loved one. Since then, I've worked to raise awareness of this dreaded disease and help save lives. And talking about detecting this disease early, my father, who was a learned man, just brilliant man, but would not get tested for reasons that men don't get tested. But following him as my role model, I hadn't been tested. And so when he passed that year, I decided to get tested. And I went in and they found 13 polyps. So it's clear to say where I was on my way. But I have gotten a colonoscopy every year since then, and I'm on a 5-year plan now, so things are headed in the right direction. But just think if he hadn't succumbed to it, where I would be. And it just bothers me that we need to get men to get tested. I came up with a little slogan. I said, "Be a man, get tested." It's what is between life and death. So I co-founded the Colorectal Cancer Caucus to increase awareness of this disease. And it's amazing. This is a disease that is bipartisan. And I have had so many members on the other side of the aisle come to me and say, wow, my dad or my brother, my sister. And I just was able to, now that the Republicans are in power, I have to reconstitute the caucus. And so Mr. Green, who is the chairman of Homeland Security, is a colorectal survivor, and he has accepted to be the co-chair of the caucus. Several years ago, when I first arrived in Congress, maybe a year or so afterwards, I introduced the Removing Barriers to Colorectal Cancer Screening Act to allow Medicare beneficiaries to be covered when doctors remove cancerous growths or polyps during colonoscopies. I was proud to see the bill finally signed into law in 2020. And I introduced the Colorectal Payment Fairness Act to allow those beneficiaries to be eligible for coverage immediately. In addition, I introduced the Donald Payne Sr. Colorectal Cancer Detection Act to provide more options for Medicare beneficiaries to get colorectal cancer screenings. In the last 2 months, I requested President Biden to issue a presidential proclamation to declare March as National Colorectal Cancer Awareness Month, and I was honored that when we declared it on February 28th, the president saw fit to do so. I also introduced a resolution in Congress to support the designation of March as Colorectal Cancer Awareness Month. Right now, I am looking for more ways to increase awareness and funding for efforts to fight this disease. We need to increase screenings and treatment options to reduce colorectal cancer deaths nationwide. There is no reason people should succumb to this dreaded disease. It's all about early detection. And these events are critical to increasing supporters and saving the lives of future colorectal cancer patients. Again, I am proud to be here with you in this fight, United in Blue event, and I look forward to our continued fight. We're not done yet. Thank you.
Congressman Payne also knows how to do a strong arm. He's very good at it. 10 years Congressman Payne has been fighting with us, and that is incredible. And for the survivors in the room who are going to be meeting, or in the room, I keep thinking this is my living room. But for the survivors, you're going to meet members of Congress. You're going to meet individuals who are like Congressman Payne, who will be champions with you, who will fight alongside you and share your passion. And so I'm so encouraged by his appearance today and his story and his willingness to be committed to our cause and to reduce barriers to screening and access to care. Next, I'd like to bring former Congressman Ron Klink to the stage. He is a colorectal cancer caregiver. He is an incredible champion, and he has truly volunteered his time to raise awareness around colorectal cancer, but also to take action against this disease. So thank you so much for joining us.
There was a time I would have just leapt up on the stage. Wisdom has taught me that those days are behind me. Thank you very much. For Congressman Don Payne Jr., his father was a friend of mine, was a mentor of mine. We were on the Education and Labor Committee together, and he was a very learned man, and the country lost a lot when he passed. And the same with Congressman Don McEachin. As I was saying this morning, imagine, if you will, who gets better health care, who has access to better health care than members of Congress? But when members of Congress themselves are not getting tested, when the message has not even gotten to them, how can it get to the general public? And that's why your presence here on this mall and your presence on the Hill is so vitally important. You've got to get that message out. You've seen it. Many of you have experienced it. And to share your stories are so important. I want to share just briefly a story that my wife was diagnosed with colorectal cancer early in 2000, just before COVID hit. And so she did a test. They said, well, you better get a colorectal exam. She got the exam. They said, we're going to do surgery right away. They scheduled it for March 4th, which happens to be her birthday. So what do you get the girl who has everything? Colorectal surgery, right? What was amazing is when we went in the hospital, 5 o'clock in the morning, University of Pittsburgh Medical Center, Shadyside, she's getting ready. She takes her clothes off. She gets her gown on. They're coming in. They're doing the prep. And all of a sudden, there's 8 nurses standing there. And I'm like, what's going on? They sang happy birthday to her. That's when you know you've got great caregivers. But then the surgeon came in, and he sang happy birthday to her. And let me tell you, he could sing. I mean, if the surgery thing doesn't work out, he's got a future. So anyhow, we had a great outcome, but not everybody has a great outcome. And I'm going to introduce you to somebody who had a tragic outcome. She's become just a dear, dear friend of mine. 10 years ago, a little over 10 years ago, she lost her husband, who just turned 40. We met because in our efforts to do what we can to fight colorectal cancer, we both came together under the banner of this company that we're volunteering to work with. It's a behavioral science company called Rehavior. And they were working with the University of Pennsylvania. I'm not going to get into a whole lot of it, but they were able to, using behavioral science, double the number of African American men who would get tested with colorectal cancer, knowing what to say and what not to say. When you say to them, look, come in and we're gonna test you, and you know, if we catch it, we'll treat you. Now, all of us consciously are saying, yeah, makes sense. What we learned with the behavioral science was subconsciously they're saying, I don't want to hear today that I've got cancer. And you can't get over that unless you know how to talk to them. So the same people, you say, would you like to dance with your daughter or your granddaughter at her wedding? That's a different discussion. Whole different discussion. And they're going, okay. Well, this is a selfless thing you have to do for your family. It's not about you. Oh, no, it's a different, okay. So we went from 18%, only 18% of these men were getting tested, to almost 40%. And that's where Arkell and I have come together, working. We're out on the road doing. We were a week ago Friday. We were at Downstate Hospital in New York. But nobody can tell her story better or has a more touching story than your next speaker. And I'd like to bring Arkell Cox to the stage. Her husband was a businessman. He was an agent who dealt with many of the top name entertainers that you all know. And fortunately, Arkell has those friendships and is able to tap on those shoulders to get them to bring attention to what happened to her husband, David Diamond Cox. And she has the David Diamond Cox Foundation, which I'm sure she'll talk to you about too. I love you. Take care.
I appreciate you.
Talk well. You always do.
Oh my God, this is so amazing. Thank you, Congressman Klink. You have become such a good friend of mine and an advocate, and I appreciate you. As he said last week, we were in New York because I'll call and he'll get in the car and he'll meet me wherever we need to go. And so, as the Congressman said, my name is Arkell Cox. I am from West Orange as well. We had somebody here from West Orange earlier. But I'm grateful. I'm grateful to be here today. I'm grateful for the opportunity that you've afforded me to speak and to tell my story. It's not an easy story, as many of you know. We're sitting here and we're here for a reason and a cause. But the thing is that we just have to be better with the message. We have to be better with what we're doing, right? And so for me, my husband passed away in October, 10 years ago, stage 4 colorectal cancer. My husband was 40 years old. He died 2 days after his 40th birthday. His mother and father are approaching 80 years of age, and they're healthy and fine, thankfully. But that means, what happened? Where did this cancer come from, right? And so people in my group, in the last 10 years, we no longer call it colon cancer. We call it the cowardly cancer, right? And as many of us know, it's a cowardly cancer because it's in your body. If you go ahead and you get your colonoscopies, those polyps are removed, you go home to your family, right? You go on to live your life. But it's the education. As Congressman Payne said, there are many stigmas. There's not enough education. There's not enough conversation about having a colonoscopy, right? So I want us today to leave here and to think about that. We have to change the narrative. We're not out here freezing for no reason, right? We're out here for a cause. So we have to now say to ourselves, how can I be a part of this? How can I be a part of change? So for me, I say to people that 2 days ago, I was telling my sister here, 2 days ago, something came out on the internet, and it was one of these, artists. My phone was ringing like crazy saying, oh my God, did he really pass away in a car crash? That went through the internet as a rumor. Let's start spreading rumors, right? Let's start spreading rumors, but good rumors, and saying to people, go get the colonoscopy. Many of us grow up in our homes, and I said this before, if you have a headache and you're squinting and you're looking at the TV, your mom or dad would say, you need glasses, you need to go get your eyes checked out. So you go to the ophthalmologist. But when you have blood in your stool, when you're losing weight, when you're constipated, does anybody say to you, go get a colonoscopy? No, because it's not conversational. Let's change the narrative. right? Let's change the narrative. Let's make sure that we're telling people you don't have to die from this disease. For me, my husband was 40 years old. We were just beginning our lives. We were just starting our college funds. We were building our businesses. And now I have to do everything with my children alone. That's not the way it was supposed to be. We started our foundation 10 years ago called the Dave Diamond Cox Colorectal Cancer Foundation. And what our foundation does, we pay for colonoscopy for men. We go with you to the doctor. We will pay your rent. We will, whatever happens, we are there for you. And more importantly, we're educating. We are educating because no one has to die from this cowardly disease. So if you take away nothing today, if you take away nothing, take away that we can change the narrative. It's a simple conversation. Suggest to somebody once they're telling you, oh, I don't feel well, I feel constipated. Don't let it go. Save their lives. Do it for me. Do it for everyone in this crowd. So for me, I want to say again, thank you to United in Blue. I love you too. Thank you so much. I appreciate you guys. And again, awareness is key. Let's change the narrative. Appreciate you. Thank you. I really appreciate it.
First time I met her, I think the second sentence she said is, what are we going to do? I'll do anything. Let's do it. And that's what I love about Relentless Champions of Hope, is that when you look at somebody, the first thing they say is, what can I do? Let's fight this thing. So next, I want to bring up a very special group. So Trevor Maxwell, I will say this. I saw you in Chicago, and I said, Trevor, get that surgery done because I need you well, and I need you in Washington, D.C. And he was like, oh, yeah, whatever. And I said, no, I need you in Washington, D.C., like legit. I need you in Washington, D.C. He is such an inspiration to so many of us, men and women alike. And he has such an amazing wolf pack. Man Up to Cancer is one of those amazing groups that is started by a survivor. And there's momentum because there's community. And there's a breakdown in stigma. And there's trust. And there's authenticity. And so I'm so grateful that Trevor has joined us today to share his story alongside his wolf pack. So I'm going to invite the wolf pack up with Trevor.
Up here. All right, here, you guys get together. Wow, thank you, Angie. I guess I'll just say, like, 5 years ago, after I got diagnosed and that first year of going through anxiety and depression, and a lot of you guys know my story, is that I was on my floor basically and not even able to make a phone call or do a text. So the imagining being able to be here with you today and to speak up here, dreams do come true, and you can change the world, and these guys are changing the world right here. So I am a husband. I'm a father of 2 teenage daughters. I'm the founder of Man Up to Cancer, and I'm a friend to all of you here. I've been living with stage 4 colon cancer. Next week, March 22nd, will be my 5-year cancerversary. So I've gone through, and then on 2 weeks from now, on March 29th, I'm going to go to Mass General Hospital for my 6th major abdominal surgery. And gone through immuno, chemo, been in the trenches. So I've been in the trenches this whole time with all of you. I see you, right? And I am fortunate to stand here with the Fight CRC family to call for action. We need to improve screening, research, and patient outcomes. You know, not next year, not next decade, but right now. So talking about men and advocacy, and Congressman Payne brought this up, obviously this is my lane, right? So there was when I started getting into advocacy 2019, I saw a photo from a CRC event, and I don't know which one it was, but there was like 25 women, and there was one guy in that photo. And I thought to myself, as men, as patients, survivors, caregivers, why are our spouses and partners and sisters and aunts and all of these women fighting for us, and we're not in those photos? That's not okay. So we are here to show you that we are going to stand and fight with you. So these guys standing up here, there's a lot of crossover, obviously, between Fight CRC and Man Up to Cancer. Man Up to Cancer is a 2,000-strong pan-cancer community of men, and we have a great relationship with Fight CRC. A lot of these guys are part of both communities, and I want to acknowledge these guys who stand with me in solidarity today. These guys are changing the way that men go through cancer. And we've lost, we have this banner right here. As a community, we've lost about 150 of our members over the past 3 years since we started. And, you know, probably at least half of them were CRC. So these guys stand here, and we stand here for our fallen brothers. I just want to acknowledge these guys for a minute. Give them a round of applause. So as most of you know, colorectal cancer is not a someday problem. This is not a planning exercise. This is not a drill, right? We're dying. We have been caught in the cancer wildfire, and it is not encroaching, it's here. And those of us in that wildfire often feel unseen, unheard, discarded. So before I turn up the volume on this rally, I need to share with you a little bit of our heartache. So these pictures, these are three of my friends. Jared McMillan, a lot of you knew Jared, Mac. I want to hold that, Joe. So Jared was known in our group as Iron Wolf because he loved the gym and he had the strength of iron. Jared was a U.S. Air Force officer who was forced to medically retire in 2020. He was universally loved by those who served with him. Jared was diagnosed with colon cancer at age 33. I told him, hang tight, Mac. The next big breakthrough for treatment is right around the corner. Jared died on March 26, 2021, leaving behind his wife and 4-year-old daughter. This is Alex Pabon. Alex was from Cameron, North Carolina. He was a respected chef. He was active duty U.S. Army at Fort Bragg. He devoted his life to serving God, family, community, and country. And in the year before he died, he founded the Azul Foundation to help other cancer patients. I told him, hang tight, Alex. That next big breakthrough is right around the corner. He died on May 20th, 2021, leaving behind his wife and 5 children. This is Wes Madison from Marquette, Michigan. Wes was training to be a firefighter when he was diagnosed with stage 4 colon cancer at age 23. Like many young cancer patients, Wes was told by multiple doctors that he shouldn't be concerned about his symptoms and that he was too young for cancer. I see a lot of nods out there, right? I told him, hang tight, Wes. The next big breakthrough is coming right around the corner. Wes died on April 26, 2021, leaving behind his fiancée. When newly diagnosed CRC patients join our Man Up to Cancer community, sometimes I still hear myself telling them those words. Hang on, it's right around the corner. These breakthroughs are coming. And at this point, I'm not sure whether it's truth or just mercy. So these blue flags out here, each of these flags is the next Jared. It's the next Alex. It is the next Wes. These are young people just starting their lives, 20s, 30s. They are building families. They are building careers. And they have no idea that this fire is waiting for them, right? They don't know. That's why we're here. They all deserve better. They deserve more federal funding for research, incentives and creativity, not just to come up with more effective treatments, which are desperately needed, but to understand why more young people like us are getting colorectal cancer. When I tell people that CRC is increasing for younger people and by 2030 will be the leading cause of cancer death for people under 50, and I was diagnosed at 41, they always ask me why. Is it not within our capacity as a country to answer that question? To tamp down that wildfire? If it is in our capability, as I believe it is, then what on earth are we waiting for? So I'm going to take up more time than I was allotted, but who's going to pull the stage 4 guy off the stage? That would be tough. Because now, thank you for honoring my friends with me and the thousands of others of our CRC dead who no longer have that chance to speak for themselves. But I do want to talk about hope, because all three of these guys, they would want us to get fired up about what we're here to do. Like, that's what they would want. So I get the absolute privilege, being in this disease personally and as an advocate, I get the absolute privilege of seeing humanity, the very best of humanity, and the enduring beacon of hope every day of my life. I see you, individuals and families holding each other up, connecting to share the burden and life-extending knowledge. I see generosity of heart and spirit in the face of hardship. I see a CRC community determined to solve problems and make life better for people impacted by this disease. There are so many reasons to be hopeful. More patients, survivors, and care partners than ever before are getting involved in advocacy, fundraising, research. Gone are the days of the divide between the providers and us lowly, uneducated patients. We are partners in our care, we are partners in research, and we're not going back. Yes. All right, so do we have some hope out there in the crowd today? Let's show them. Let's give a fight CRC on 3. All right. So 1, 2, 3. Fight CRC. That was actually decent, but if they're gonna hear us in this town, we gotta bring it up a little bit. All right. Let's do it one more time. 1, 2, 3. Fight CRC. If you're out there and you're just getting started in advocacy, like maybe this is one of your first events, maybe you're thinking, what do I have to offer? I didn't think, like what is it that I can bring to the table? And I didn't think that either. When I was first starting out, like sharing my story, I thought I have nothing to add. And so I just want to, I guess basically my message on that is, you are already enough just as you are. Your experiences, your feelings, your knowledge, your opinions are powerful, and they have the potential to affect positive change in the landscape of cancer care. As advocates with Fight CRC, your voice matters, and our collective stories make a huge impact today and tomorrow when we go to Capitol Hill, when we speak to our elected officials about this crisis. When we put our voices together, united in blue, there is no barrier we cannot overcome. There's no goal we cannot achieve. So in closing, it really is an honor to be here. Thank you for being our friends, and thank you for being here. And I may be angry, yes, you can tell, like I've got some anger there, and I've got sadness, right? Like anyone who's been in this, there's a lot of sadness, there's grief, but I do have hope. 5 years in, I do absolutely have hope. And hope, no matter what happens, no matter how long we have in these human forms, is something they can never take away from us. Thank you very much. Yes. Thank you guys so much. Let's head down. I took up way too much time.
Gotta lower it.
Way down.
Good morning, everybody. I'm Angie Nicholas. I'm the chair of the board of Fight CRC, and I am honored and privileged to be here today to represent not only the board of this amazing organization and group of people, but also to honor my husband, John, who was a stage 4 cancer survivor and would have been living with Trevor, howling and wolving and all the things that men do together to fight. It really touched me to hear Trevor's story and to hear about how men are getting together. But more importantly, Trevor talked about why. Why is this happening? Why are young people getting diagnosed with stage 4 cancer? It doesn't make any sense. We as a country can get together. We can spend the money to find out. Why are 8-year-olds getting diagnosed with colorectal cancer? Why are 16-year-olds? Why are 45-year-olds? It makes no sense, and it needs to stop. We have the power. We have the ability. We have a voice. We must use that voice today, tomorrow, and every single time that you vote to make sure that they hear us. I always say that when things happen, John always brings bad weather. So you can thank him for this. My toes are now frozen, John. So you could bring out the sun. That would be really fantastic. And now we're going to unite together.
Yes. So group 1, I'd like you to start lining up over here, group 1. So while they're lining up, I'll just share this. I told our Fight CRC team, I was like, oh, United in Blue, let's make it bigger and badder. Let's have every single organization and partner say something. Molly and Aaron were like, I'm going to shut off the Zoom right now. Like, I'm not talking to you anymore. But the fact of the matter is, I think it is so incredibly important that every organization, every partner, everyone that's in the fight gets to put a stake in the ground and say, I'm in this fight with you. Because there's so many people in this fight. So we are taking the time because we're in Washington, D.C., and we really want to be heard, and we have this rally, and we have you here with us. So group 1, we've got our amazing ambassador that's going to kick us off here.
Hey, besties! Woo! My name is Sarah Broaddus. I'm a stage 4 colon cancer survivor, and I am a 2023 Fight CRC ambassador. And today, I am fighting for everybody under the age of 45 who has to fight to be heard, who has to fight for screening, who has to look their children and their spouses in the eye and say, I have cancer, and then who is dying too young. We are going to go tomorrow to Capitol Hill, and we are going to change this world. Let's go! Woo!
Wow, some tough acts to follow. Hi, my name is Marissa Brown, and I'm the Senior Vice President for State and Local Advocacy at the American Cancer Society Cancer Action Network. And like many people, I'm honored to be on this stage with Fight CRC, United in Blue, and all of the many representatives of organizations here. ACS CAN, American Cancer Society Cancer Action Network, also known as ACS CAN, for those of you who don't know, is an organization committed to changing laws. And we believe and we stand for ensuring that every American has access to the prevention and the treatment that they need. That's what we're fighting for. We know that everyone needs that access. We know that prevention makes a difference. We've heard it here. We know that some patients will continue to incur cost sharing for follow-on colonoscopies. That needs to change. We know any cost at all can result in patients not scheduling treatments, not scheduling prevention screenings, and that can have life-threatening consequences. And we know now is the time to give people across the United States the access to the prevention and care they need to survive this disease. I will say one more thing, which is I can't even speak to how honored I am to be with patient advocates, people who stand up and share their story. It makes such a difference And it is what will change the laws. It is not lots of people with lots of data. It is people like you and people across this country who stand up and say, this is my experience. What are you going to do about it? So thank you for being here, and thank you for everything you're doing.
Good morning, everyone. My name is Everett Cunningham. I am the Chief Commercial Officer at Exact Sciences, the makers of Cologuard. I want to give a number to you, and that is 44 million. There are 44 million people out there over the age of 45 of average risk right now that are not screened for colorectal cancer. 44 million. And actually, my wife and I were two of them last year. My wife, who is a physician, tested positive with Cologuard, had a follow-up colonoscopy, and they found a grapefruit-sized mass in her colon. Now, thank goodness she caught it early. It was precancerous, but she was one of those 45 million that was walking around with no symptoms. So we at Exact Sciences are here to fight to close the gap, to make sure that we can get people screened early, get people screened often, and we are here also to ensure that there are options out there. In addition to colonoscopies, there are non-invasive options that are effective, that are easy to take at your home, that are accessible. Insurance covers it, and we just need to make sure that we bring the 44 million people down. So if you're out there, you're not screened, please get screened, and thank you so much for having me in Exact Sciences here. Thank you.
Good morning. My name is Daniel Blumrich. I'm the Executive Director of Marketing, and I'm here with my dear colleague, Rebecca Cohen-Alvarado, and she's the head of the patient advocacy group. On behalf of Bayer Oncology, we want to thank for the invitation today, and the Fight CRC team for having us here today. And we are committed to help the organization to improve colorectal cancer patient care. We're also here to renew today our commitment to support colorectal cancer screening and access to treatment in general. We are also here to share and continue to share and amplify the stories of patients, some of our own colleagues even who are affected by colorectal cancer. And we are thanking for the invitation, and we are thankful for being a part of this organization and this community. So thanks for having us. Have a great day.
Good morning, everyone. My name is Erin Peterson. I am the Senior Director of Mission and Partnerships at the Colon Cancer Coalition. It is so good to see everyone here today. At the Colon Cancer Coalition, we are really fighting for equitable access to on-time screening for colorectal cancer. Whether that means you're 45 of average risk, or you have family history and need to be screened earlier, or you're having symptoms, you need to have access to that colorectal cancer screening through a colonoscopy or other option. We believe that if we can make the words colon, colorectal, and colonoscopy part of the everyday language, we can save lives. I want to thank Angie and Molly and the rest of the Fight CRC team for having us here today, because as a community, we really are stronger together.
Hi, everyone. I'm Dr. Crystal Denlinger, and I'm Chief Scientific Officer at the National Comprehensive Cancer Network, or NCCN, which is a not-for-profit alliance of leading academic cancer centers devoted to patient education, research, and care. I'm also a practicing medical oncologist in gastrointestinal cancers who treat people living with and through a colorectal cancer diagnosis. NCCN is honored to be here today and is really here to make sure that important medical information is available and accessible to people facing colorectal cancer during what we know is a really difficult time. We have freely available resources for colorectal cancer information and decision-making for healthcare providers, as well as people living with and facing a colorectal cancer diagnosis and their caregivers. Resources include guidelines for screening, diagnosis, treatment, genetic and familial risk reduction, and survivorship, as well as education materials and meetings. We are also committed to advocating for equitable care delivery so optimal care is available for everyone. You can find all of our resources free at nccn.org or on our apps. And again, thank you very much for the invitation to participate today.
Good afternoon. I wanted to thank Molly, Angie, Michelle, and Fight CRC for uniting all of us. I don't know if anyone else's neuropathy is barking at them, but it's doing a number on me right now. My name is Richard Farr. I actually work at Pfizer. I'm a director of Oncology Patient Solutions, where I help hundreds of thousands of patients access our 22 product portfolio, including colorectal. I don't just fight CRC inside the office. I'm also a survivor, and I'm coming up on my 5 years. No evidence of disease. So that's a big milestone. And again, I want to thank everyone for having us here. Like most patients who were diagnosed, and I was 35 when I was stage 3B, a lot of early adult onset patients have late stage diagnosis, and no one can tell us why. I've read 20% of new CRC patients are under 55. That's doubled over the last 10 years, and more than half of them are late stage diagnosis. And so we all know the old adage that if you want to go fast, you go alone. If you want to go far, you have to go together. And so we need to unite together and figure out why. We need more research, more funding, and just more breakthroughs to help change patients' lives. And so I want to thank you all, and thanks.
Hi, my name is Manish Singla. I'm a gastroenterologist that works about 5 blocks from here. I'm wearing blue, but my lips are blue now, so I didn't need to wear a jacket. I'm here and I'm listening. I'm here to fight to get everybody screened and get people who have symptoms the right procedure they need. And I think what I keep hearing here is that patients feel like they're not being heard. So we're listening. Okay, we're trying. And we're here to fight the disease with you all. And the thing that I would ask everyone here to do is be like my dinner table. We use the word poop, we use the word butt, we use words that I shouldn't say in front of everybody here, but we use the word ass, we use the word shit, we use all of those words. I use them at dinner, I use them at parties. I offer colonoscopies at DC parties. Okay? Everyone here knows somebody who is due for a colonoscopy and isn't getting it. So use your persuasion. Talk about it. Convince, cajole, shame. Use whatever you need so that everyone gets the procedures they need, the screenings they need. We're here to help too. I'm here with Capital Digestive Care, and if you're local, we will see you. But please help us, and we are listening, and we're going to do our best, and we'll do better. Awesome. Thank you for your time.
All right, group 2, come on up, please. All right, Michael.
Let's go, Michael.
Floor's yours.
Housekeeping note, I've been asked to ask group 3 to go ahead and line up and be ready to go. So my name is Michael Holtz. I have been talking about my ass and shit for 11 years. My diagnosis anniversary is actually March 27th. And in December, my oncologist released me from surveillance. Now, by rights, I could walk away. I'm cancer-free. I don't have to see my oncologist anymore, but I'll tell you this. I will talk about my ass, my butt, shit, my colostomy bag for as long as I have breath, because for as long as I live, I am fighting for more hope.
Hey, good morning. I'm Andrew Zebrak with Intuitive Surgical. Intuitive is a leader in minimally invasive robotic-assisted surgery. We work with Fight Colorectal Cancer on their advocacy efforts and to raise awareness of colorectal cancer and the need for more screenings. This is critical because over 60% of colorectal cancer deaths could be prevented with screenings, and we want to keep advancing use of screenings. Thanks very much for having me, and looking forward to the rest of the program. Thanks.
Hi, everybody. Congratulations so far. This is amazing. Thank you for having Bristol Myers Squibb be part of it. And thank you for working with us to advance our research to address colorectal cancer. I have to say that you gotta walk the walk and talk the talk, right? So we support research and innovation that meets unmet needs, and we know there continues to be unmet need in this area. I recently got my colonoscopy screening done. Yes, I did. I delayed it for about 3 years because I was so scared for anything to be found. And then my sister was diagnosed with liver cancer last year, and I said, that's it, I'm going. I do my mammogram, I do all my other annual visits, I'm getting my colonoscopy. And thank God it was clear. But these flags in blue behind me remind me of all of those we've lost who weren't as fortunate. And I want to be thankful to all of you for the work that you've done to get this moment here today. Thankful for the patient focus that you continue to push us to make sure we're doing and bringing to the work that we lead in global patient advocacy. So I'm here with my colleague Susan, who leads our work in the GI space. I lead the global patient advocacy team in oncology, and we're just so proud to continue to do this work in partnership with our advocacy organizations and the leaders like you and the advocates like you to advance bringing awareness to this space. So congratulations to the United in Blue, congratulations to Fight Colorectal Cancer and all the organizations out there who continue to put pressure on this topic and bring this topic focus so we kick ass at the White House.
Good afternoon. I just want to first thank Fight CRC for organizing this amazing event today. My name is Caitlin Kubler, and I'm representing the Prevent Cancer Foundation. We fight for increased access to cancer prevention and early detection by amplifying the patient voice, influencing public policy, and most importantly, empowering people to stay ahead of cancer prevention and early detection. My mother's cancer was caught through a FIT test, one of the early ones, and had she not had this test at the age before the screening was even recommended, she would not be here today. Mom, I know you're watching the live screen. I love you. I'm so glad you're here today. It is so important. Thank you. It is so important that we all prioritize our routine cancer screenings because early detection equals better outcomes. Thank you so much.
Good morning, everyone, and thank you for this opportunity. My name is Dr. Daniel Pambianco. I'm the president of the American College of Gastroenterology. And like my colleague before me, we hear you, and I want to take your message back to all the practicing clinicians that we are training from the get-go, from the cradle. On that note, we represent 18,000 gastroenterologists and gastrointestinal specialists. And the ACG is fighting for quality colorectal cancer screening, which is very important, trying to improve PrEPs, trying to get you through that process as an investment in your care. It's not an easy exam. It's not like just going having a chest x-ray. You all know all that. The data shows that quality colonoscopies and polyp removal is a powerful tool for colon cancer prevention, as you've all heard. And finding early saves lives, and removing these polyps. Age 45 is the new 50 to start colon cancer screening research. Screening for average risk individuals. So there are many options, as you are hearing here, and the most important thing is getting screened. That's the most important thing. You need to talk to your doctor about colon cancer and screening, as well as talking at the table. And I would leave you with a mantra that this is preventable, it's treatable, it's defeatable, and we can all do that together with United as we stand in blue here. So thank you for the opportunity of the American College of Gastroenterology. Thank you.
Hi, my name is Haley Smoot, and I'm the Director of Public Policy with the National Coalition for Cancer Survivorship. Really excited to be here today and to be partnering with everyone, and thank you, Fight Colorectal Cancer, for inviting us today. Is that me getting some feedback? Okay. So I also lost my dad to colon cancer just almost 6 years ago, and I had to fight tooth and nail to get my own screening at 33 and get it covered by insurance. And so I definitely understand the fight to get screening when you need it. And so at NCCS, we fight for all cancer survivors and fiercely advocate to improve or fiercely advocate for policies to improve quality of cancer care, your communication with your doctor, your coordination of care, and your quality of life from diagnosis through the end of your life. So thank you so much again for having us today, and it's great to be here. Thank you.
Thanks. Good morning. Thank you for having us. My name is Susan Wysocki, and I'm the Executive Director for Paltown, the nonprofit organization that grows communities of hope. We support more than 8,000 colorectal cancer patients and caregivers in our flagship community, Colintown. Our community is built by patients and led by patients with more than 120 neighborhoods for every age, stage, and facet of the CRC experience. I personally came to Colintown as a caregiver for my daughter Jessica, who was 17 when she was diagnosed with stage 4 colorectal cancer. And I was looking for that peer-to-peer support that we could have only found in Colintown. We encourage patients to be active partners in their own care, to understand their disease, their unique circumstances, their treatment options, and their path forward, whether it's CRC 101, understanding their biomarkers, or navigating the clinical trials ecosystem. Why? Because we understand that educated and empowered patients have better quality of life and, most importantly, better outcomes. I mentioned Jessica, who was diagnosed at 17. She quickly became an advocate for CRC because she wanted other people to know, especially young people, that colorectal cancer is not just an old man's disease. She died the day after what should have been her high school graduation. She dreamed of becoming a surgeon like her grandfather. And at the time, it seemed inconceivable that a 17-year-old, a teenager, would get stage 4 CRC. But I'm here to tell you that we are seeing an alarming number of adolescent and pediatric cases of CRC, so much so that we started a special community to support the families of our youngest patients, Colintown Junior. As Angie mentioned, we are seeing 8-year-olds with stage 4 CRC, and that 8-year-old that you mentioned, his name was Khalif, and we called him our little king. He died in December. Now, I want to share with you, and if that shocks you, it should. And what should also shock you is that 25% of all IBD cases are now in children. And we know that we've all talked about the JAMA article that by 2030, CRC will be the #1 killer of 20 to 49-year-olds. But what I don't think you know is that people are not reverse engineering that statistic. They are not connecting those dots, because that 20-year-old in 2030, those are the 10, 11, and 12-year-olds that we're seeing now. But these kids are already stage 4. So I'm here to tell you that this disease looks completely different in the under 25 age patient cohort. They have fewer congenital hereditary syndromes. They have far more T2 lesions. They're far more likely to be mucinous or have signet ring histology. They have 5 times the peritoneal metastasis, and they're 6 times more likely to die. There's an over 90% mortality in this age group. So I just want you to know there was another little boy in our group. And by the way, we know that there are environmental and epigenetic factors that are driving this, and we need to find out why. We know what some of them are. We just need to fund them. I just wanted to leave you with a little story about one of our juniors. His name was Jaden Oakes. He was only 11 years old when he was diagnosed with stage 4. And we went down to Chapel Hill, North Carolina to visit him after he had had HIPEC surgery. And they had removed over 1,000 tumors from this little boy. The largest was just over 7 pounds. He died telling his grandmother that all he wanted was to have his first kiss. I'm here to tell you that as patients and caregivers, we need more. We need more funding, we need more research, and we need more answers, because this has to stop. Thank you.
Hello, everyone. I'm Steve Itzkowitz. I'm the chair of the American Cancer Society National Colorectal Cancer Roundtable. We're here, and we thank Angie and Fight CRC because we are a coalition of organizations, healthcare providers, advocacy groups, survivors, policymakers, public health officials, industry, academia, cooperative cancer centers, anybody involved in the colon cancer screening and treatment space really is represented by the National Colorectal Cancer Roundtable. We meet every year, we share ideas, we exchange best practices. All during the year we have programs now on Zoom, in person at times, and we are really here to prevent what has arguably been called the most preventable but the least prevented cancer. I'm a gastroenterologist. I lost my best friend 30 years ago to colon cancer at the age of 32. When I do a colonoscopy and I find a large polyp and I remove it, I feel so good because I've definitely prevented a cancer. But when I do a colonoscopy and I turn a corner and I see a mass staring me in the face, my heart just sinks. We should never have to encounter that. We should never have to encounter a cancer when we can find polyps, remove them, and the patients are fine. So thank you so much for being here, and please, we have a lot of resources on the NCCRT website, Fight CRC. All of the people in this audience have a lot of resources to offer. Take advantage of them, but more than that, really talk about it. That's what I'm hearing is talk, converse, don't be embarrassed. Thank you.
Hey everyone, I'm Brooks Bell, and I'm here as a board member of the CDC Foundation, and we're here to help CDC get all the resources it needs to grow and run their colorectal cancer control program. And I'm also here as a survivor. I was diagnosed, thank you. I was diagnosed 4 years ago at age 38. And I fight to help rebrand colon cancer as the preventable cancer. When you hear the word colon cancer, you think of the word preventable. And that you also know that you tell everyone that colonoscopies don't just detect it early, they also prevent it. And they're not that bad. Thanks, everybody.
Okay, thanks everybody. We're going to call stage 3 up. I'm sorry, stage 3. Group 3. Group 3. Ela, you're first. Come on up. All right.
Good morning, everybody. My name is Ela Flores, and I'm from Florida, where it's a little warmer, so I am freezing right now. But I am a survivor, stage 3. I was diagnosed in 2020 just as COVID was shutting down, and I will tell you that I had no symptoms. I had no family history. This was completely out of left field. I never saw myself dealing with this, but you know, you never think it's going to happen to you until it happens to you. But I tell you what, I am fighting for you, and I'm fighting to take down some of these flags that we see back here. That's what I'm fighting for. Let's take it back. Let's kick back, guys.
Hi everyone, my name's Leah McPherson and I'm representing the Cancer Support Community, a global nonprofit. We're dedicated to offering compassion and support to anyone impacted by cancer at every stage of their experience, easing the burdens of cancer and eliminating barriers to care. Fight CRC, thank y'all for inviting us here today to this inspiring event. Have a nice one.
Hi, everybody. My name is Martha Raymond, and it is just wonderful to be here with so many friends, colleagues, and community. And so, Angie, I would like to thank you, the board of Fight CRC, Molly, all the staff for
your hosting us and bringing us together in this united effort. I'm here today wearing two separate hats. As part of the Raymond Foundation, we named the Raymond Foundation in honor of my parents, Margaret and Patrick Raymond, who both passed from early onset colon cancer. When they were diagnosed in the 1970s and 1980s, colonoscopy was in its infancy, and so they did not have the option of screening. Today, that has all changed, thankfully. We have many options in screening. And so all of us today here as advocates, we know the importance of that. And I recognize that those that have passed before didn't have those options. I'm also here speaking on behalf of my sister, who also passed from early onset colon cancer. I proudly wear my lanyard with their photos on it in memory of my family. And this year, I celebrate 20 years as a survivor of early onset colon cancer. Which Angie asked me earlier yesterday when we were putting up the flags, how does that feel? And I said, I don't really know. It's kind of surreal, but I'm very blessed and very grateful. And over the past 3 decades that I've been in advocacy, just meeting so many wonderful people, and all of you here has just been incredible. The second hat I wear today, I'm very proud of as Executive Director of the GI Cancers Alliance. The GI Cancers Alliance was founded by Dr. John Marshall, who is right here of the Rush Center at Georgetown MedStar, And we represent all of the gastrointestinal cancers. We give voice to those that may not always have a seat at the table from smaller disease states. And when Dr. Marshall's vision came to light, he had a group of us at ASCO GI at a dinner, and he said, we need to unify. We need to provide a voice, a forum, and we have done just that. And so many of you here today are part of our alliance. To date, we have just about 100 advocacy organizations as part of the GI Cancers Alliance and many partners, and so we thank you for that, and we invite you to join us. Together, we are stronger. Thank you.
Good morning, everyone. My name is Julie Hamburg, and I'm representing Guardant Health. For the last 10 years, we have been fighting to conquer colorectal cancer with data and develop blood tests to help guide patients' treatment decisions, monitor for recurrence and residual disease, and even help to screen for the earliest signs of it. Not only are we trying to give patients and their families more insights, more time, and a chance for more hope with our blood tests, but we are fighting to make screening available to more people so we can save more lives. We stand united in blue with all of you. Let's go conquer cancer together. Thank you.
Hello, everyone. My name is Dr. Rosaline Chirania. I'm a medical oncologist, and I have taken care of patients and families with colorectal cancer for close to 15 years. This cause is very dear to me. I'm also the Executive Medical Director for Oncology Imaging with Evacor Healthcare. And it's an honor to be present here today with various advocates, with survivors, with their families, to highlight the importance of early detection and prevention of colorectal cancer. At Evacor, we are passionate about this cause because we truly believe, and it's been said many times before, but we want to hear it again, screening prevents death. It saves lives. Screening saves lives, and that is what we are here for. At Evacor, with our colorectal cancer screening program, we try to identify barriers. We want to improve access to screening. We proactively outreach individuals who should get their colorectal cancer screenings but have not been able to do so. We try to identify the barriers they have. We inform them of the benefits they have and why they need to get it done. This is an important cause that we are all wanting to collaborate with you, so thank you for that opportunity. It is very important to us to improve the well-being, health, and vitality of all Americans, so thank you, Fight CRC, for inviting us and allowing us to be here today.
Hello, everyone. Good afternoon. I just want to say hi. So if you can say hi, raise your hands. Hi. Okay, I was just trying to help you guys get a little warmer. Hi, I'm Adjoa Chimertain from the National Minority Quality Forum. And we're here with some good news and some bad news. But we're really here to unite in blue and to say we're here to shift cancer. The bad news is that, unfortunately, Black Americans are more likely to get colon and colorectal cancer. We are also more likely to die from it for a myriad of reasons. The system isn't kind to us. So if you're Black and brown with colon cancer can be pretty scary. But the good news is what has been known as a silent killer is silent no more. Look at all of you here in your beautiful blue, right? At NMQF, we have something called the Cancer Stage Shifting Initiative. We're all about screening at earlier stages, because we know screening at earlier stages can save lives. They can go from a 90% survival rate to a 14% survival rate if it's caught in stage 4. So it's very important to us. The Cancer Stage Shifting Initiative is to move us from late stage to early stage cancer diagnosis. And I'm happy to say we were just in Flint, Michigan, doing colorectal cancer screening with our friends at Fight CRC and Exact Sciences, and we're taking it to your local neighborhood, so please invite us. Yes? Yeah. Because like someone else said earlier, colonoscopies don't have to be scary. Screening doesn't have to be scary if it's caught early. We truly believe in treating polyps early because we know it can save lives. So I hope you can join us in our mission if you go to shiftcancer.org, that's SHIFT cancer.org, or visit us at nmqf.org. And I hope to see you all next year with a few less flags behind us. Thank you so much.
Angie and Fight CRC, you guys are awesome. You guys are awesome. My name is Dr. John Marshall. I'm the proud director of the Rouge Center for the Cure of GI Cancers. I work down there. I actually now have another office over there. But I am very, very proud to be here on behalf of our entire team. Our mission is to bring people together and to answer the why. Now, one of the first questions about why is, why blue? Because we know it should have been a brown ribbon. It just should have been a friggin' brown ribbon, and it should have been a big old bowel movement, curly bowel movement, that was scratch and sniff. Trevor, that would have worked, baby. That would have worked. That's the way it should have been. That's the first why. I want to say that our center has not been highly focused on screening. Don't get me wrong. Screening is really, really important, but most of you need to know that almost all of my patients had been screened. They were screened properly, but they were still my patients. Don't get me wrong, I've been watching for the last 30 years my clinic go from nobody under the age of 50 to more than half of my clinic is now under the age of 50. And I don't know why. And don't get me wrong, I hate it. Just this morning, I was looking eye to eye at a 44-year-old with 2 high school kids who's crying, asking me why. And I didn't know why. I didn't know why she wasn't going to get to see him go to college. I didn't know why, and we need to figure that out. So don't get me wrong, but this is the wrong way of putting it, but I'm going to do it anyway. Why I'm happy about you young people getting this disease is it's making people listen. And what we learn from you people and on you people and before these people end up becoming those flags is going to change lives, not just for colon cancer patients, but for patients for many, many diseases. I'm convinced of that. But I want to bring one more point to this that was just mentioned, but I want to echo it. If you're diagnosed with colorectal cancer and your zip code, home zip code, is 1 mile that way, your survival is 1 year less than if your zip code is 1 mile that way from where we are sitting right now. And part of our charge at the Rouge Center, and something we're doing as a nationwide effort, is to try and bridge that gap, that access gap. It's probably not genetics. It's probably not something interior. It is an access problem, and we've got to solve that, and together we can solve that as well. So again, thanks for having me.
Thank you, John. Michael Sapienza here. I'm the CEO of the Colorectal Cancer Alliance. I'm here to help support our great friends at Fight CRC. Thank you, Angie. Thank you, Angela. I'm also here to remember my mom, Chris. So we were born here, a family born in Washington, D.C. We spent many a times, I remember from the earliest age I possibly could, at the age of 3, right behind us where all of these blue flags are, running up and down these hills. And I now stand here with all of these people, all of you, and really believe that we can end this disease in our lifetime. So I hope every single one of you will go back to your communities, do all the amazing things at Call in Congress, exactly what John is saying. How do we make sure, no matter what zip code you live in, what you look like, that we can end this disease for all? So thank you.
Hi everyone, I'm Tai Fujita, General Manager Endoscopy at the Fujifilm Healthcare Americas Corporation. I'm very glad to be here with you today. When you hear the name of Fujifilm, you might think about the photography or film, photo film. Yes, you wouldn't be wrong, but Fujifilm has grown since then. Today, we are strong, patient-focused, and sustainability-minded global healthcare company. Fujifilm, taking our nearly 90 years imaging expertise and placed it at the tip of an endoscope. Actually, I bring it.
I'm afraid of snakes.
So maybe most of all here didn't see the actual endoscopy, right? How long this is? This is the actual colon length. Everyone has. So this is our product. And giving doctors, their staffs, the highest quality imaging available during the colonoscopy, the gold standard screening for the colon cancer. So we provide a lot of technology in this here to support doctors to detect and remove the polyps before they turn into cancer. I'm here today representing Fujifilm. They are Fujifilm. Hey, everyone, stand up, stand up. Thank you. So, because with PREPAR screening, everyone already told, colon cancer can be one of the most preventable, treatable, and beatable diseases. So we partner with Fight CRC to encourage patients to commit to routine screening, which can prevent more than 60% of colon cancer deaths. This was Fujifilm's goal of ending colon cancer and our commitment to never stop innovation for a healthier world through this endoscopy. Thank you very much. Thank you.
All right, group 4. Now, many of you know me that I am willing and able to prescribe because I am a physician. So we have GI doctors here, we have a colonoscope, and all of you have butts. Yeah. So line up. We're doing colonoscopies right here on the mall. Woo! All right, Paula, you're first.
Hey, thank you. Hi, good morning, everybody. Yes, My name is Paula Chambers Rainey. I am a relentless champion of hope. I am a colorectal cancer survivor. And I want to tell you, I fight for survivorship. I'm here today to talk to you just very briefly about my first call on Congress, and I'm going to just make this really quick, but I want to tell you, when I first came, I kind of thought I understood what I was going to do and what I was going to say, but I found myself being really nervous. I wasn't sure that my story would resonate or that it really even mattered. When I got into those halls and those rooms, I listened to the people that came before me, the ambassadors that had gone before me, and I listened to them tell their story, and I followed suit. I felt a little less nervous the second office. Then the third office, I got a little, hey, little juice going. The fourth office, I was like, y'all do work for me, and I don't see you very often in your district. You don't come very often for town halls. Why don't you ever talk about colorectal cancer, but I see you at that pink one all the time. And then the fourth one, I was like, hi, my name is Paula Chambers Rainey, and I have colorectal cancer. I was diagnosed in the ER after no one listening to me for over a year. Why are y'all not doing anything? So what I want to tell you is, I know some of y'all are nervous. It's okay. That means you're on the breakthrough of doing something good, right? We're here to help you. I went through that too. So bring that nervous energy. We're going to turn that into fire. I want to thank y'all all so much for being here. If you need anything, if you need some encouragement, if you're a little nervous, come talk to us. We're here. I'll walk you through tomorrow. I'll help you. I'll give you ideas. And I want you to remember, this is your time. Your story matters. You matter. We are fighting for survivorship. We want education. We want awareness. We want you to listen to us. We want dignity. We are here as survivors. Thank y'all.
Hello, everybody. I'm Scout. This is Liam. I originally put him in to warm him up, and now I have no idea how to get him out, so he says hello. I'm the executive director of the National LGBT Cancer Network, and I'm thinking that last year at this exact same time, despite how incredibly motivated I am related to cancer screenings, I, as a trans and non-binary person, was 1 year late for my colorectal cancer screening. I'm happy to say I've done it now, but it's the fact that people like me can't figure out whether doctors are welcoming. That means that we're less likely to have doctors as our primary care providers in the first place, get our routine prophylactic screenings, and get someone urging us to go get screenings at places where we're not necessarily sure if they're going to be welcoming for us. So for that, I want it to change. We are here for every lesbian, gay, bi, trans, queer, intersex, and asexual person to make sure that we get access and then that we're counted so we can understand how many of these flags out there might actually relate to us. Thank you.
Hi, I am Allison Rosen. I am a 10-year early age onset colorectal cancer survivor and a very proud ostomate. I am here representing the United Ostomy Associations of America, and there are nearly 1 million people whose lives were saved by ostomy surgery. Many of them were colorectal cancer survivors, like many of us in this audience. So we're proud to be here to fight colorectal cancer and all the partners here to break the stigma that exists around ostomies, as well as colorectal cancer. So just like it was said earlier, it's preventable, beatable, treatable, and let's do it together.
Thank you, Allison. You have been such an inspiration to me as an ostomate. I also want to pause here and just say that I think it's sad that we don't all have a puppy inside of our coats to keep us warm today, because wouldn't that be wonderful? I've been looking at him with a little bit of jealousy for a couple of hours now. My name is Brenda Green, and I am a marketing manager at AmSurge. I am also a stage 4 colon cancer survivor. And you are my people. One of the things that we are ever so proud of at AmSurge is that our 180 plus endoscopy centers across the country did over 1 million colonoscopies last year. That is impressive. But you know what? We all know, because of these flags that are out here and because of the voices like mine and yours, that there are a lot more that need to be done. We know that colonoscopy prevents and detects colon cancer, prevents. And we know that if we could get more colonoscopies out there for people who are 45 and older, who have symptoms, or who have a family history, then we can eradicate this disease. Our website, stopcoloncancernow.com, is dedicated to educating people to understand the benefits of colonoscopy and to remove the stigma and fear related to it. We fight with you to get people screened. Thank you.
Good afternoon. I'm Vince Wong. I'm the Chief Commercial Officer of Geneoscopy. I think I win the award of wearing the most layers, but wish I had a puppy. But on behalf of employees in Geneoscopy, we're based in St. Louis, but we have employees across the country who get up in the morning, go to bed at night, trying to develop the latest new technologies in colorectal cancer screening to try to be part of the solution to find precancerous polyps and colorectal cancer in a non-invasive way. And so we're leveraging RNA technology, just as scientists use RNA to tackle the COVID pandemic. We're using RNA to try to tackle colorectal cancer screening and bring new innovation to patients. And so it's our honor to be partners with Fight CRC and Angie and her crew. Just amazing, just balls of energy. They're working on behalf of our community to increase access, and so it's our privilege and honor to be part of that community. Thank you.
I'm a little shorter. I'll pull this down. Hi, everybody. I am Fletcher Wilson, and this is,
I'm Jess Heinzelman.
we are the founders of Throne.
Wow!
Cool.
You guys are our people.
Yeah.
Our poople.
She makes the puns. So we are on a mission at Throne to expand bathroom access for everybody, but particularly people with healthcare-related bathroom needs, and particularly and especially people affected by colorectal cancer. So we're so happy to be here. We think this is a great way to show exactly what we're doing and to help people here.
Yeah, and we've been so excited to participate with you over these last 2 days, offering a functional advocacy tool that serves a very specific need for this community, while also is going to continue to raise awareness of everybody that is visiting the mall over the cherry blossom season for the next 2 weeks while the flags are up as well, and then in DC for another 2.5 months. So thanks so much for this partnership with Fight CRC and Miralax that's making it possible for us to keep the cleanest bathroom that I hear is great for changing your colostomy bag. And we just am so excited. We hope we can see you in all the cities you've come from in the future with better bathrooms.
Thank you.
Hi there. My name is Molly McMaster Morgaslepov. You guys can all try and spell that if you want to. I was diagnosed when I was 23, actually on my 23rd birthday back in 1999. So if you want to do the math on it, go for it. But I'm just going to tell you I'm old now. When I was first diagnosed, my doctor said, you know, there's no way there's anybody else like you. You're too young. There's nobody else in the country like you, maybe even the world. You know, and I remember thinking to myself, well, that's crazy. I can't be the only one. And I ended up meeting a young woman named Amanda from Little Rock, Arkansas, who had been diagnosed when she was 24. And it was the best thing that could have possibly happened to me in my cancer journey. I lost Amanda. She was 27 when she died, and her cousin and I started the Colon Club as a way to, right? We're kind of fun, I think. We started the Colon Club as a way to raise awareness in out-of-the-box ways, especially in young people, because now you guys all think you're cool because you're talking about poop and shit and stuff like that. We were doing that years ago. But no, we started the Colon Club to raise awareness in what we like to call out-of-the-box ways, to make people laugh, to make people joke about it, to sex it up, if you will, which is how we came up with the Colander, which has now become On the Rise magazine, which many of you guys have had the opportunity to come and be a part of. We're gonna, the Colon Club is all about doing those crazy things, but what's been kind of fun to see happen through the years that we didn't expect. Let me back up for a second. When I was first diagnosed and angry, the big crazy project that I did first was to inline skate from New York to Colorado to raise awareness, to show people, look at this 23-year-old. If this can happen to me, it can happen to anyone. And at the time, somebody signed my guest book online, and they said, Molly, one drop of rain ripples an entire pond. And I never realized, come full circle, look around, because that's what the Colon Club is about. That's what this is about. We're all the raindrops now. And it's not just a little pond anymore. We're making waves. And I know I heard someone earlier say, we want change today. And yes, it's slow. It is slow. But let me tell you what, when I was standing by myself back in 1999, the change is amazing to see and to be a part of it. Thank you so much for letting me be here today. And thanks, you guys.
Hi, I'm Candace Henley. I am the founder of the Blue Hat Foundation, and I would ask you to do something for me. Can you stand, please? Because you've been sitting down a long time, and I know you're cold. Okay, so I need you to loosen up a little bit. Loosen up, because you're about to go to the White House tomorrow, so loosen up. All right, loosen up to the left. Come on. Loosen up to the left. Loosen up to the right. Come on. Back to the left. Back to the right. Do a little faster. Back to the left. Hey! Back to the right. So you just did the Love Your Butt dance that I expect to see you do tomorrow, okay? So listen, this today is to energize you. You've heard a lot of stories. You have seen a lot of people who have been survivors, who have talked about stories of their loved ones, who have shared information about their organizations. So tomorrow, you are tasked with an action, and that action is to tell them to go blue or go home. Now, say it again. Go blue or, say it again. Go blue. Okay, go blue or go home. Let's do the strong arm selfie. Go blue or go home. Thank you so much. It has been a pleasure to have you here. Thank you, Fight CRC. You all are awesome, and all of you are awesome. See you tomorrow.
Okay. Thank you guys for sticking it out with us in the cold. In closing, as we wrap things up, thank you. Okay. In closing, as we wrap things up, and for those of you online, we hope that you stay active virtually and take a part of our advocacy efforts online. So be sure to be tweeting, posting, taking action alerts. But today we want to bring up all the Fight Colorectal Cancer staff and board members onto the stage, please. Just real quick. I mean, everybody, even Sam, our guy who's always behind the camera. Come on. I think I still see Fight CRC staff out there. Do we have everybody?
Elizabeth.
Where's Elizabeth? Come on, Elizabeth. Andy, come on. Aaron, stop it. Come on. Merritt, Paula, Carol, come on. Okay. All right. Okay. I already fired her 4 times. But here's what I want to say to everyone here. There are days when you can't fight. There are days when you're tired, and sometimes it's really hard. And for everybody who's watching online, 365 days a year, we fight. We fight for you. This staff fights for you. All of us have personal connections to colorectal cancer and cancer. I am so incredibly proud of this staff for dreaming big because we want to end colorectal cancer as we know it with our partners, with our survivors, with our community. And so I really want to thank you for being a part of United in Blue, being a part of our advocacy efforts here in Washington, D.C. And I assure you, we will fight hard. And by 2030, these flags are coming down. Yeah. Thank you. Awesome.